In blood recently, I was able to lead a study with our group at MD Anderson examining the question if JAK inhibitors in patients with myeloproliferative neoplasm, MPNs, if they are associated with or cause a lymphoma. And for this study, we wanted to directly address the questions that were brought up by our European colleagues, Pemmaraju et al. In blood last year. In the Pemmaraju study, they showed a statistically significant association of JAK inhibitors causing lymphoma in patients with MPN. However, in our study, importantly and interestingly, we did not find the same association. In fact, in our study, approximately twice the number of patients, about 2,500 patients, in a retrospective data analysis, we found after cross-collaborating with lymphoma, pharmacy, pathology, and our own leukemia and MPN databases, that we did not see this association. Now this is important because you have two differing data sets now in the literature. In our data set, twice as many patients, so a larger number, so that's able to even out if there are any random occurrences. A second part of this is that these are American versus European data sets, so that could be a very interesting demographic or possibly environmental differences. Finally, there were important differences in treatment. In our study, we did not have any patients who received pipobroman, whereas in our European colleague study, a couple of the patients did receive that older agent, sometimes associated with carcinogenesis on its own. Overall, we're talking about a pretty small number of patients that developed lymphoma out of the greater group, and the supposition from the European colleagues was important that maybe, possibly, there's a subset of patients with MPN who have some sort of a pre-lymphoma or IGVH rearrangement of genes, and this is something that needs to be looked at further by all groups. Lastly here, it's important because long-term monitoring is important for any patient in any cancer with novel agents, and so any of these therapies that are 10 years or less on the market, we all need to be vigilant about monitoring for any type of complications, cancer or not. And then lastly, there is this concept of older patients, typical patients with MPN, who already have a concomitant incidence of other malignancies, solid tumor and liquid tumor, before, during, and after their therapies. And so that has to be considered and measured out. So this is the major findings of our paper, in contradistinction to our European colleagues from the year before. So as always, further studies will be needed by other groups around the world.